Hi everyone, I am Stephanie with 9 Health. Today we are talking about a very important topic because there's a lot of stress in our lives. The pandemic, the election is still going on, wildfires in Colorado. A lot of stressful events have happened. Maybe you or a loved one are turning to substances. We want to talk about substance misuse prevention programs in our state. I have several experts joining me this morning. I'll introduce all of them in just a moment. I do want to let everyone know that we do have some tools to check in on your mental health at 9healthfair.org. I'll put the link in the comments. Check in on your anxiety or depression. It's free, it's anonymous, takes a couple minutes. You can do it whenever you want and just kind of see where you stand for the day. Because again, a lot of stressful things going on, a lot of things that are kind of out of our control. So let me introduce to everyone that we have with us this morning, a lot of experts, a lot of ladies. Thank you all for joining us. I have Claudia Zundel, she's Director of Community Prevention and Early Intervention for the Office of Behavioral Health. Shelley Evans, Executive Director for Community Health Initiatives in Glenwood Springs. Gretchen Vandekar, she's Chief Executive Officer for Rocky Mountain Youth Corps in Steamboat Springs. Michelle Stecker, she's Executive Director of Mountain Youth in Edwards, Colorado. And of course, we have 9 Health expert, Dr. Powell Coley joining us. She's a cardiologist, but also an expert in internal medicine, preventive medicine. Thank you again, ladies, for joining me. Dr. Coley, I want to start with you because COVID-19 is one of the stressors in our lives right now and causing even more stress. Cases are going up again in our state, across the country. Can you just give us the latest on COVID-19 today? And Dr. Coley's still muted. Let me see if I can get her to unmute herself. There we go.
Hi, sorry about that. I said, I'm so glad that we're having this conversation because really we are standing at the precipice of what we're calling exponential spread for COVID-19. So in fact, I would say we've already entered the exponential spread phase. So in the last few days, Colorado has had more than 2,000 new cases every day. And that compares to just a few weeks ago when we were having about 300 new cases a day, just to give you some perspective. We also saw a positivity rate that's about as high as it's been since the beginning of the pandemic at over 11% yesterday, which again tells us a few different things. One is that the disease activity is increasing. The second is that, we're not doing enough testing for that positivity rate to be so high. And the third is that our hospitals are really at risk for getting overwhelmed. So based on the way that the cases are spreading right now, we're looking at really about 6 days, November 10th, before we hit the peak of hospitalizations that we had in April. And recall back in April, we had field hospitals, we had PPE stockpiles, we had all of these other backup plans to help us. And now as we head into the winter with flu season oncoming, we really don't have that. So because the cases are increasing so much, I think the mental health impacts of many of the restrictions that are going to start to come back, the fatigue that's set in from having been doing this now for several months, all of those are pretty dramatic. And therefore, I think the substance use discussion we're having today is very important.
Yeah, I agree. Again, as Dr. Coley said, we're talking about substance misuse prevention programs in Colorado to help you or your loved ones. Let's get into it. Several of the experts on this can answer this next question, but Claudia, I'll start with you. Talk about what the term prevention means and why prevention programs are important.
Sure, thank you. I think when we think of prevention, most people would think it's a really good idea. If you think about physical health diseases, it makes a lot of sense to prevent the diseases before you have to deal with the consequences. And I'd like to just share with you a short metaphor that I think really illustrates the difference between prevention and treatment. So it goes like this. There was a man and a woman sitting on a riverbank fishing, and all of a sudden they saw a young woman in the current struggling. So they ran out into the river and they rescued her. And then pretty soon there was a man who was struggling in the current, and they ran out and rescued him. And all afternoon people kept falling in the river and they had to rescue them. And finally, exhausted, they decided to walk upstream and see why so many people were falling in the river. And what they found was a beautiful scenic overlook that did not have a protective barrier, no warning signs. And so they marched down to City Hall and they told them about how many people they had rescued, and wouldn't it be a good idea to put up some kind of protective barrier or signs. And so the city council did, and it prevented people from falling into the river. And I think that just clearly illustrates the difference between the upstream approach, where we involve the whole community and we try to prevent the negative outcomes from happening to the downstream or the treatment approach, where we're having to pull out each individual and work with them. What's fortunate is that we know a lot about how to prevent substance abuse. We've had 30 years of research, and I think that the cost of failure to prevent behavioral health problems is far too high a price to pay when we know that there are predictable positive outcomes that can be achieved. These 30 years of research have told us about individual, family, and community risk and protective factors. We know that there are a group of factors that we can impact and make a real difference on substance abuse. At the individual level, an example might be friends who use peers who use substances. At the school or community level, a protective factor might be the connection to school. At the community level, a risk factor may be how available alcohol and drugs are. And because we have this body of research, we at the Office of Behavioral Health have invested in a number of communities to help them think about what are their particular risk and protective factors and what strategies will work for them to actually prevent the issues in their community.
Yeah, I think that's a great way to approach it. That was a great metaphor as well. And I wanted to give everyone else a chance to kind of answer this too. Michelle, if you want to add to that, like what prevention is, and then also just talk about your organization as well, Mountain Youth, and how it supports Colorado youth and families.
Sure. So here at Mountain Youth, we're based out of Eagle County. Our mission is to continuously and collaboratively improve the lives of youth in the most powerful ways possible. We do that through family education, youth advising and engagement, life skills programming in schools, policy work and environmental strategies, safe driving, and more. And like Dr. Coley mentioned, beyond the physical health implications of the pandemic that we're facing right now, mental health is on the forefront of many people's minds. And so from our standpoint, connection is more important now than ever. A lot of our work revolves around creating opportunities for events and connection. These days, most of those look like virtual platforms and outdoors. And just to add on to Claudia's great description and metaphor around the importance of prevention, from our standpoint, we focus a lot of our efforts on universal approaches where everybody gets exposed to the program or the service. We take a community-based approach, and we look a whole lot at shifting norms. Up here in Eagle County, there's a lot of celebration around the party lifestyle and resort atmosphere, and many folks turn to substance use and misuse as a coping mechanism. And so we work really hard from our prevention efforts to look at healthier alternatives.
Yeah, I think all of that is great. And Gretchen, if you want to add to what prevention is and also tell us about your organization, Rocky Mountain Youth Corps.
Sure, thanks, Stephanie. Yes, a lot of what Michelle talked about resonates well with us. Rocky Mountain Youth Corps is located in Steamboat Springs, Colorado, and Routt County. We serve 10 rural counties in Northwest Colorado. As Claudia mentioned, there's a lot of risk and protective factors that go into prevention, and one of the ones that Rocky Mountain Youth Corps really focuses on, one of the protective factors is resilience. So building resilience in a young person. And so what that does is it increases their ability to overcome challenges and desires for risky behavior. A prevention program, for example, could provide a safe space for an individual to challenge themselves and overcome a challenge that is seemingly not able to be overcome. And through that, guiding them through that safe challenge and having them succeed will build resiliency and self-confidence in them that will give them, some of the assets that they need to avoid risky behavior. So Rocky Mountain Youth Corps, we support Colorado youth and families along with our other sister corps throughout the state by providing the opportunity for youth and young adults from Northwest Colorado to overcome adversity in a safe and supportive environment, while also having them contribute positively to their communities and their environment. So our work is done outside, and a lot of that work, just the benefits of that work that they do is also a big benefit to Colorado families. We work on a lot of outdoor recreation amenities, trails and wildlife areas and fire fuel reduction and those kinds of things. So the impacts to the youth and young adults themselves is great because it's a really difficult job that they have, but they are also through the avenue that we've chosen to build that resilience. They're providing opportunities for the rest of Colorado to be able to get outdoors and be healthy, both physically and mentally. Rocky Mountain Youth Corps also provides wages and job readiness skills for young people. So that really helps support their own personal and their families' economic needs, and allows for also youth and young adults ages 17 and over to get AmeriCorps Education Awards, which not only bolsters what they're coming out of it with, but it also, through research, we've found out that also encourages them to get higher education. So all of these kind of experiential, residential, especially outdoor type prevention programs, it builds resiliency in young people. It allows them to not only experience or learn about these strategies, but to experience them. So when they walk away, they have a deeper and longer lasting, toolbox of impact to help them, to avoid risky behavior in the future. Thanks.
Yeah, and being in Steamboat, it's a great place to be doing all that outdoorsy stuff and getting youth out there. Shelly, you're with Community Health Initiatives. I'm just giving everyone kind of a chance to introduce themselves. Tell us a little bit about your organization, how you help Colorado youth and families.
Yes, we're a nonprofit based on the Western Slope, and we serve the communities between Aspen and Grand Junction all the way through Delta. And I love what people are talking about. I love learning from my peers. And I know Michelle and Gretchen and I are just getting to know each other. And I really appreciate that they have a focus on youth and families. And we do as well at Community Health Initiatives, but we also have maybe even more of a focus on community-based prevention. And so what that might mean to someone is that we would sponsor prevention programs serving young adults, serving youth, serving families. But we also would implement community-based strategies such as media campaigns and all kinds of community education. And then a strategy we're working on right now and had to move to the virtual world is alcohol-free, family-friendly events and trying to get messaging out about alcohol and marijuana. One of the programs that we're really focused on right now that has a lot to do with substance use and mental health is a program funded by the Office of Behavioral Health, and it's called FOCUS, and it's called Families Overcoming Under Stress. It's a program for veterans, other service members and their families, and it builds resiliency, communication skills, parenting skills. And we have seen over the course of a few years some really significant decreases in alcohol and marijuana use during and after the program. And then we've also seen some great increases in improved communication skills and in parents feeling really confident about their parenting skills. I wanted to comment on one thing that Claudia said. Having worked in the field of prevention for 33 years now, I know I'm only 23, and how is that possible? But I have seen such amazing change in the science behind prevention. We used to throw a lot of programs up against the wall, see what stuck. Most of them didn't stick. We spent millions and millions of dollars across the country and across the world, and we didn't have a lot of science behind us. And I would say, and please correct me, anyone, if it sounds incorrect, but over the past 20 years, for sure, we have a lot more science, and it is based in risk and protection, and it's based in community, family, school, individual, peer, the healthcare community. We're trying to integrate behavioral health and medical health together, and there's science behind all of this. And I'm so excited about that, that we are I believe that we are seen as a true discipline, just like the treatment industry, just like medical health. Prevention has really shifted into science.
And I would add a couple of things to that, Shelley. I'm going to piggyback off of Claudia's analogy here and say that primary prevention, or preventing the people from falling into the river, is significantly more effective than secondary prevention, which means trying to rescue them once they've fallen in. And we may be asking ourselves, who are the people right now that are at biggest risk in terms of mental health problems and need to have primary prevention targeted to them? And I would say that's every single one of us, because just think about what we're living through. It's entirely unprecedented. We have a global pandemic where people are getting sick with a highly infectious, contagious disease every single day. We have wildfires that are raging through our mountain communities. We have our kids struggling with virtual learning, and not having the experience of in-person school. We ourselves are isolated from our peers, our family, our loved ones. With the holidays coming, we have to think about dialing that back. And on top of all that, we now have the election and, all the stress that goes along with the election and voting, protests and riots and violence. And so I would say it really is the perfect storm of so many factors that now more than ever, that primary prevention strategy for each and every single one of us is something we need. And I'm so glad we have all these wonderful resources available to help us with that.
Yeah, and I've put links to all the organizations. Everyone just talked about their organization. I put those links in the comments, so you can check those out. Dr. Coley, I also wanted to just get tips from you on taking care of our mental health as a provider, as a physician. Just touch on, it's all important that it's important that all of us really check in on our mental health right now. What are some tips and advice that you can share?
I think the most important thing I would start with is awareness of yourself and awareness of your family and loved ones. And that really involves recognition and really realizing when either you yourself may be starting to develop some mental health problems that need to be addressed, or your level of stress is chronically high and it's starting to affect your daily functioning, or that's happening to someone else. And often we don't really, it's very subtle. It creeps up on us because we continue to keep compensating. And then one day we just cross that threshold and tip over. So a great way to really recognize that as it's building up is to take routine mental health screenings. So there's a great one available on 9healthfair.org where you can just kind of check in and see how your health is doing, your mental health, once a week or a few times a week. I know I do that sometimes, and it just helps me to understand if I'm starting to head in the wrong direction. Because like I said, the first step is awareness. And then the second step is, connecting yourself or your loved ones with the proper resources, such as the ones we're talking about here today, with step number 3 then being devising some sort of a treatment strategy. Now, I will say it's really important in general at a time like this, as much as I love the news, to take regular scheduled news breaks. And what I like to do is to call it my worry time, where I schedule the time that I'm going to be watching the news, catching myself up, and it's usually limited to only about an hour a day. So it's not, invading my entire day. And similarly, before bedtime, you want to be sure to spend at least an hour where you're off your devices. You're not, connecting with the bad news out there or getting on social media and hearing about the latest controversy, but you're really taking some time to decompress. And I think those types of preventive strategies incorporated into our daily routine are now more important than ever.
Yeah, and I like that you call the time you're going to watch the news your worry time. So you're acknowledging that I might get a little worried during this time that I'm catching up on stuff. Let's talk a little bit more about what we've seen during the pandemic. Claudia, I'll start with you again. How has the COVID-19 pandemic affected youth and families that you've seen and the risk for increased substance use?
Yes, unfortunately, we are seeing some signs of increased distress and increased substance use. For example, our Colorado Crisis Services that has been in existence for 6 years, in September and October saw the highest number of calls to date. And that's at least a 33% increase from what we saw last year. I would also say that we have data that shows that alcohol sales are up. Nationally, it's about 54%, and the online sales is like 500%. But here in Colorado, if we look at our tax revenue, what we've seen is that there's definitely an increase from last year. It was up like maybe about 13% in March, And in May, it was almost 50% higher than it was last year. And then we also have seen marijuana sales increase. We reached $1 billion in sales between March and August of this year.
Yeah, I remember when we talked, I talked with the Office of Behavioral Health and several experts, in May for Mental Health Awareness Month, and we were talking about the number of calls to Colorado Crisis Services and how it was the highest it had ever been in March. And now, again, it's the highest it's ever been in September, October. So there's a lot of people that do need help out there. I'll put the number for Colorado Crisis Services in the comments along with the website. You can also text, but really that's for anyone that needs help, or if you even want to reach out for a loved one, you can contact Colorado Crisis Services. I can also, I want to get input from everyone else on this. Just Michelle, I'll ask you next. Talk about the COVID-19 pandemic, how it's affected youth and families, and the increased risk for substance use right now.
Sure, thank you, Stephanie. Up in Eagle County, I think one of the most telling statistics is that for much of 2020, we have lost more lives to suicide than we have to COVID in our community. And so with that, we definitely continue to have a huge focus on creating connection, finding opportunities to get together in safe manners to combat some of those feelings of isolation, along with the other ancillary impacts that 2020 has brought with economic stressors, natural disasters, learning and working from home, and then stress and anxiety due to COVID specifically. And so for us, the mental health has been forefront. A couple of the positives that we've seen here in our community through this year, through the pandemic, have been young people just recognizing opportunities to influence their peers in a positive way, to help inform on the importance of abiding by restrictions through various youth-led projects. There's incentive funds throughout our community, much of it channeled through Mountain Youth, to help support those positive connection opportunities and safety information sharing.
And Gretchen, I'll let you add to it as well, just what you've seen as far as how the pandemic's affected youth and families.
Sure, and thanks for that more of a broad community perspective, Michelle. What I want to focus on a little bit is, just what everyone's talking about, with all the stressors and the kind of lack of ability to socialize in person. For kids, teenagers in particular, your peer group is your most important influencer. And, I have 2 teenage boys at home, and they spend endless hours in their rooms. And it's kind of bittersweet. They're on their video games, and they're actually interacting with their friends on their video games. That is kind of their primary outlet to socialization. And, before COVID, I would say, you shouldn't be on your video games so much, but, they're just trying to have these connections. So as a parent, how do you make that balance? How do you allow your kids to have that outlet without it becoming, a dark hole that they're in their rooms for 12 hours a day? And then as parents, parents, especially of younger children, having to not only, manage their kids like they normally do, but they're having to be their teacher and learn how to, keep them focused, and having their kids try to teach themselves online learning and whatnot. There's a lot of stressors there. And when kids don't get the socialization that they need, then they're lacking that self-value, right? That they get when they're interacting with their peers in a positive way. And that can spiral into depression and I've had personal experiences with young people, being so depressed, they don't know how to get out of it. And substance use is whether they think it's a solution or a distraction, they don't really have the frontal lobe ability to decipher that, but they just know that, hey, there's something I can do to get out of whatever I'm feeling. And that's really cause for concern. And I guess just a bit of advice is like, winter's coming, we're going to be indoors a lot more. Just spend time, go into your child's room and watch them play the video games and lure them out and try to find other outlets that they can socialize and find self-worth. those are the things that I think are important to start focusing on as more of an upstream for sure tool. So thanks for that.
Yeah, it's definitely a challenge right now. I have an almost 5-year-old and we're struggling with the amount of screen time and trying to motivate him to do other things. And it's just online preschool, but it's still obviously been a challenge and a challenge for a lot of parents right now. Michelle, maybe you can add to that and then also just talk about some ways to prevent substance misuse during these times. Or I was going to give Shelley a chance to also talk about this. Just Shelley add to that. And then if you want to talk about prevention ways to prevent things.
And we're seeing some of the same things that other people are seeing. People have lost their jobs, one or both parents. We have some of our program participants that their cars have been repossessed. There may be a parent that is ill with COVID or has been exposed to it, and now they can't take care of their kids as well as they would like to. An anecdotal story I have is something we're seeing with parents and their alcohol use. So maybe there, I'm just going to say, so there might be a set of parents that typically they wait till their kids go to bed before they have any alcohol at all. And surprising to us was learning that these same parents are drinking much earlier in the day. They're often drinking all day long and they're drinking daily versus how they might have only been drinking a couple of times a week. So they're not even taking a break from the alcohol. And, I know that people use substances and make unhealthy and unsafe decisions when they're under stress like this. So I think we need to pay close attention to what everyone's saying about the level of stress that's occurring in our communities right now. So the connection is really important. I think addressing what people are saying with no judgment is really very important too. I also, we're seeing an increase in binge drinking in youth and young adults. And so the definition of binge drinking, it would be 4 to 5 plus drinks over a 2-hour period, let's say, once a month or more. And our binge drinking rates in the rural resort area are already really high. And I am going to project that those are going to be even higher during this very stressful time.
Yeah, like Dr. Coley said, it really is like a perfect storm of everything that's kind of happening right now. And it's hard to take care of yourself. And that seems like an easy escape to just kind of start drinking. And especially for parents that are dealing with a lot right now, that might seem like the best thing at the moment to do, I guess. Dr. Coley's talked about this before though. Dr. Coley, is it just from a health perspective strictly, it's 2 drinks a day for men and 1 drink a day for women, right? Otherwise you start having some major health complications.
That's exactly right. And that's on average because women have a obviously smaller body mass index and a volume of distribution. But in general, I say less than 1 drink a day for women and less than 2 drinks a day for men on average. And those binges where, I don't drink during the week, I just drink 5 drinks on the weekend. That's a big no-no because that's a big dose of alcohol you're giving yourself all at once.
Yeah, so it might be a stress relief at the moment, but you are, putting your health at risk as well, your physical health along with your mental health. Gretchen, maybe you can add, before we have to wrap up here, just add a little bit about preventing substance misuse during these hard times and advice for anyone that's concerned about their loved ones and what they should do.
Yeah, thank you, Stephanie. I think a lot of times folks, they feel very isolated during this time and, people are drinking more or using more substances and just know that you're not alone, that in fact, you're probably in the majority. And, you may be wanting to cut back on your use. And I'm willing to bet that there's a lot of people, even in your inner circle, that are wanting to do the same thing and to just lay it out there on the line. And I think Shelley said, something about, there's a stigma about mental health and whatnot. Let's face it, we could all use a little dose of mental health during these times. And sometimes it's just connecting with your loved ones and with the people in your inner circle and just being open and honest because you're not alone.
Yeah, I think that's something important to realize. We talk about reducing the stigma all the time. It really is just opening a conversation about it, which can be hard, but maybe you start with yourself if you're struggling. Michelle, I want to give you the chance to add anything else that you would like to add as well, and then we're going to let all these ladies go and sign off from here.
Thank you. I would just really strongly recommend making a plan. As Shelly said, we're going into the winter. We're going to be indoors even more. The days are getting shorter with the light that we have. There are a lot of concerns coupled with those. So making a plan, examining your relationship with alcohol and other substances, and thinking about alternatives to wind down. We heard from Gretchen, social connection. We can think about exercise, healthy eating, the importance of sleep, how we structure our days, spirituality, mindfulness, and then taking it upon ourselves to find what works for us and use that to model healthier behaviors, whether it's for young people around us or our peer networks. So maybe instead of that Zoom happy hour, it can be a virtual book club, game night, a movie watch party, or a hike outdoors. We live in a beautiful state here and have a lot of healthier alternatives that we can take advantage of. I would just say too, if you are concerned about your substance use or that of a loved one, I know Stephanie plugged some great resources in the chat. I would say, please don't hesitate, reach out immediately. Better to err on the side of safety. Check in and have a conversation with someone. If it's a friend, a neighbor, a pastor, somebody that you connect with, so that we can hopefully get through this year and next year and come out stronger together.
Yeah. I mean, my husband and I, just as an example, we wanted to wind down at the end of the night with some kind of beverage. So we were finding ourselves drinking more, especially at the start of all this. And now it's become like, let's try some tea tonight. Let's just have something else that might be calming or relaxing. And that's working so far. So that's something that's kind of helping us. I mean, I know maybe not a lot of people could just turn to tea, but it's helping us. I do want to let all these ladies go. I've kept them for a while, but again, 9Health has some mental health resources on our website as well at 9healthfair.org. I put a link in the comments. I put a link to everyone's organization along with Colorado Crisis Services. You can call, text if you or anyone is having trouble or struggling right now. But the tools at 9healthfair.org, we have an anxiety screening, depression screening, free, anonymous. It's just a few questions. It's an easy way to just check in on yourself and see if you need to reach out for any further help. We did just have 9 health fairs this fall. They're done now. So if you want to get those preventive blood screenings, you still can, because we're now offering them at Quest Diagnostics Patient Service Centers. Again, go to 9healthfair.org for all the details on that and to sign up. But you can basically get those 9 health fair screenings anytime at Quest Diagnostics. And if you need a medical question answered or even a mental health question or need to know more about these resources, you can call our 9 Health Neighbors line. That number is 303-698-4455, extension 2005. 9 Health Medical Volunteer will call you back within 24 hours. That's a great resource as well and a way to talk to a real person, especially if you're not sure if you need to go into your doctor or something like that as well. But again, thank you ladies for joining me. We're going to sign off from here and talk soon. Thanks so much.
Thanks, everyone.
Thank you.